You can only lead a horse to the river, but you can't make him drink the water. This proverb explains the current reality of non-compliance to the second wave of the COVID-19 protocols in Katsina State, Nigeria. It took decades for conservative states like Katsina to accept the existence of polio and its vaccination. Same trend is on the rise as open disregard towards coronavirus stipulated measures are not put into use.
Naturally, it is obvious that some people will have this mindset of rejecting the reality or a kind of misperceiving the fact that the virus is real. The only thing is for us to appeal to them to look at what is happening in the world. If COVID-19 was not real, certainly there is no point where virtually everything will be at standstill at one point in time in the world. And professionals in the field, WHO and other stakeholders, the NCDC, have virtually confirmed the fact that the second wave is going to be more deadly, more devastating, more serious than the first wave.
In the last 3 weeks to 1 month, we noticed an increased surge in the number of cases we are seeing. And apart from that, in terms of even the morbidity, we've noticed that people are becoming more sick compared to the first wave. This led us to concur what has been happening in other parts of Nigeria and globally, that indeed we have the second wave of COVID-19.
Concern over non-compliance to COVID-19 protocols is quite alarming, as religious institutions and social gatherings hardly observed the stipulated COVID-19 protocols.
One of the challenges we are facing is the fact that it is normal, it's like a normal tradition in the Nigerian context, in the Nigerian populace, that if they don't see something killing them directly, they don't normally involve themselves in the issue of being proactive. But now, because they felt that the first wave has gone, and they thought that the second wave, to some of them, is still not in place because they have not been hearing, they have not been seeing people dying in such mass number in Katsina. That is why you are still seeing them displaying this kind of negative attitudes.
With the daily increase in morbidity and mortality rate, the state government's COVID-19 task force, business owners and health experts have expressed readiness to enforce strict compliance.
You see, not only plans, but actions and concerted measures are already in place.
A ɗauki matakai dai na wannan sa takunkumi da satanizer na wanke hannu da ɗan tazara da za a rika bayarwa, kamar ko wancan lokacin da aka yi ai kaga mu da an rarraba bokitai nan kuma an yi amfani da su kuma an yi wanke hannu da komai da abubuwa kuma an samu sauki gaskiyar magana.
As you can see, this is one of the entrance to one of the busiest markets here in the capital city of Katsina State. From the people that are going in and coming out of the market, you can see the number, or you can count the number of people adhering to the COVID-19 protocols. Almost 80 to 90% of the people that enters this market are not wearing masks, talk less of sanitizing their hands or observing social distance.
As a result, young boys can be seen at Roads Junction selling face masks at affordable prices. Noura Yalu sells bags at the Central Market, explained how traumatizing the first lockdown was, how it affected his business.
Haka ne wacce kullewa da gaskiya dan kasuwar da ke jihar Katsina, especially wanda da ke Central Market. Yau mun samu a tsalo saboda yiwuwar ba kowa da kowa ke da kuɗin da zai aje ya ci har wannan lokacin ba ka ba, dukkan mu yan kasuwa ne, amma wasu suna hemin hito a ranar nan wasu sun samu abin da za su je yau su hidimar gidansu. To an riga an kulle, akalla ina ga an kulle kuma an samu wajen kwana 21. Ina ga sana aka dan fara samun dan sauki haka. To saboda haka an samu an jijiki akai ko ba ba, kuma a lokacin da ana irin cewa an ba kasuwa tallafi, shugaban namu da suka abun an confirm an kawo, to amma dan kaso da ke cikin garin dan so Central Market ba wanda ya samu daidai da abin gan kwarar taliya guda ɗaya.
Alhamdulillahi duk wanda ke fadin jihar Katsina ya san halin da aka shiga a lokacin da aka yi wannan covid-19 wato wannan cuta ta coronavirus. 'Yan kasuwa mun shiga halin la ilaha ula'i domin an rihe wannan babbar kasuwa ba a hudda kasuwanci, to inda ma Allah ya taimake mu cikin sauki da muka samu sauki, shi mai girma da Latin Katsina Aminu Bello Masari mun kai masa ziyara a ofis dinsa kan jajanta masa wannan cuta da Allah ya jarabci jihar Katsina da ita. To daga nan ne muka yi amfani da wata dama cewa 'yan kasuwan mu an kulle kasuwa ba mu harkar kasuwanci, sai mutum ya hito wani zai nemi abin da zai ce kai ma iyalinsa, to sai zama babu inda zai hito din, an kulle kasuwa. Sai muka ce a duba wata hanyar da za a taimaki 'yan kasuwa. To mai girma gwamnan Katsina nan take dama akwai abinci da mai da gishiri da indomi, sai ce to a ba mu kungiyar 'yan kasuwa ta Central Market tare da kungiyar 'yan kasuwa ta jihar Katsina mu je mu raba ma al'umman mu 'yan kasuwa a fadin Satifo local government na jihar Katsina, wanda wannan abinci ya yi matukar tasiri ga wasu al'umma.
Unlike the polio vaccine, most residents have expressed optimism to accept the vaccine.
Yes, just like the coming of the disease itself, of course, with the introduction of any new technology or innovation, there's bound to be a lot of, mystery surrounding that, myths and what have you. The State Primary Healthcare Agency is vested with the responsibility of, providing all issues to do with vaccines, not just for COVID-19 or polio, but all other vaccines. So we are ready. We have started doing our background work to make sure that we sensitize people about the availability of the vaccine. Even though the first batch of the vaccine that will be coming to the country will be about 100,000 doses, and we are going to prioritize just from the healthcare workers and other people that are vulnerable, those with comorbidities. We are going to use our structures. We are going to liaise with the traditional religious institutions in the state to make sure that we adequately sensitize people to guard against vaccine refusal and hesitancy. I'm sure if need be, I'll be number one to volunteer. I will take it, and I will make sure that my family take it, just to show example that these vaccines are safe for everybody to take.
A zan yi amincewa mana sun da ai ni ma zan so amma haka saboda in san cewa ina da ita ko in san cewa lafiya da nake.
Jamil Mabai reporting for Click TV, Katsina, Nigeria.